Hey everyone, welcome to my channel, or welcome back. Emetophobia and mental health issues are really difficult to talk about, especially as a parent. So that's kind of how emetophobia is relevant to my channel, because parents can suffer and struggle with mental illnesses just like anyone else. The fact that people could label you as a bad or unfit parent, say that if you're watching this and you're a parent too, and you have emetophobia, you're not a bad parent. What's important is what you do with your mental illness. We're gonna get right into this.
Hi, my name is James Arthur Elliot, and I'm an emetophobia counselor and a recovered emet. I struggled with this phobia for about 25 years. At its worst, it was a specter that controlled virtually my entire life. After years of struggling with this phobia, seeing through it step by step, getting better by inches, the past few years have seen a rapid improvement and pretty much resolution of the phobia. So, having moved past it, I now try to help others do the same.
This is the why. Why did I get this way? Why am I this way? What is causing my emetophobia? I believe that I shared this in my other videos as well, but emetophobia can be caused by a traumatic event, whether it's in your childhood or not, but usually so. Or it can be caused by a distressing situation where vomit was involved. And again, often this does occur during childhood.
Can't avoid situations that cause them dread and terror. They are trapped in their body with their greatest fear, and one of the strongest triggers for that fear, which is beyond their conscious control, which is any form of stomach upset, not just nausea. Gas, indigestion, hunger, bloating, these are all shortcuts to an instant panic attack. It's one of the most reliable symptoms of a panic attack is an upset stomach. When you're panicking, blood rushes away from the digestive tract to provide more oxygen to the muscles of the arms and legs and lungs to fuel the fight or flight response. Anxiety and panic cause stomach discomfort. In the emet, this causes a vicious cycle where the unpleasant stomach sensations caused by anxiety will be misinterpreted as nausea and will fuel further panic, which makes those sensations worse, and so on and so forth. Emet panic attacks can be very long-lasting. Often panic attacks are short. And the experience of these hours-long panic attacks can be quite traumatizing in and of itself. I mean, this is basically the bodily reaction of we're about to die that is being triggered in response to something that is objectively not threatening. Try telling your body's reflex that it's about to die, trying to tell it to quieten down, that there's no threat. It's a bit like yelling into the storm.
Kati Morton actually shared a video all about emetophobia on her channel, which I'll link in the description. In her DSM book, this phobia is listed under the other section of phobias. It doesn't even make like the top few of the most common phobias. So I looked up what Kati Morton said, and NCBI, which is like a research study website that I like to refer to, says the same thing, that in the book, the phobia is not well known.
In order for there to be research done on this phobia, I mean, people who are suffering from it need to speak up. And it's my belief that to truly effectively treat this, some of the standard CBT and exposure and response prevention protocols need to be specifically adapted.
Personally, I feel that this phobia isn't very well known because it's really hard to talk about.
Most anxiety disorders, you can avoid the thing that scares you. If you're afraid of enclosed spaces, you don't go in enclosed spaces. If you're afraid of heights, you stay off tall buildings. Emetophobia, you carry around the source of the anxiety inside you. It's how your stomach feels. And that's in addition to there's an external and an internal component. The external relates to threats of getting sick from the environment, not wanting to see other people be sick, being afraid of hearing people being sick or hearing about people being sick. But the internal component relates to the subjective perception of how your stomach feels. And you can't run away from what's going on in your own body.
People understand a fear of spiders, a fear of snakes, a fear of heights, but no one understands what it's like to be afraid of your own body. To me, this phobia makes it feel like it's really hard to exist sometimes. Thanks to the power of social media, over the years, I've been able to find actual support groups. This includes Instagram and Facebook for emetophobia, and this really helps you feel less alone. Learned in emetophobia groups, which I think is the best way to learn about this phobia, is from other people who have it.
Talking about this phobia is extremely helpful to the people who have it. There's precious little research that has been done about emetophobia. We don't even really know how common it is. But every day I see people joining support groups online who have just discovered that there's a name for this fear that they've had their whole lives.
On NCBI's website, it includes some ways of treating emetophobia. There's also a very interesting study done that takes over the course of 3 years to get like a conclusive answer on if EMDR is really helpful with this phobia. I strongly suggest to click the link below and read all about this study done.
Sufferers of emetophobia are disproportionately female, and for many, the prospect of nausea and vomiting during pregnancy is enough to discourage them from carrying a child, even should they want to be a mother.
Helpful for parents or people who are pregnant or are planning to become pregnant and are suffering with this phobia would be surrounding yourself with those who support you. And not only
one thing a loved one of an emet, pregnant or not, needs to understand is that this phobia is like a black hole. No matter what anxiety starts out being about, when that anxiety causes stomach discomfort, and this anxiety often will, the focus will shift from what it was originally about onto the fear of being sick. Your partner may obsess over this prospect and he seemed to you somewhat ridiculous given all the other worries that pregnancy usually presents with. But understand that it's kind of the emet's way of channeling their anxiety, that all roads lead back to the phobia. Understanding and compassion go a long way. Recognize that even if you don't understand it, your loved one fears being sick more than they fear dying, and the suffering that they go through due to it is very real. Don't minimalize or trivialize their anxiety because of its unusual focus.
That language in childbirth is really important, but what about language around traumas? Emetophobia is kind of like a trauma. Some often refer to it as a type of panic disorder or form of PTSD.
Doctors often treat this phobia as an extension of a different anxiety disorder. For instance, if an emet is diagnosed with OCD, they'll work on treating it as they would treat other cases of OCD. But treating it just like any other mental health condition can run into hurdles when they try to apply wholesale techniques that work for other phobias, external phobias, to emetophobia, where the triggers are both internal and external.
So language-wise, if you were to vent to someone about emetophobia, and they would say something unhelpful like, get over it, you'll be okay, you won't die, that's not really very helpful.
It is something where even mental health professionals regularly underestimate the gravity of the phobia. I mean, it seems silly to not emet. Nobody likes being sick. Then again, most people don't spend every waking minute thinking about the possibility that they might be sick, particularly if they haven't been sick in years, sometimes decades, which is the case for many emets. It's the simple fact that vomiting is nothing to be afraid of. That is something emets are well aware of rationally. It's convincing their body and mind when they get in that fight and flight mode that that's true. I've frequently heard sufferers told by friends and family that, oh, they should just get over it. It's dismissive and diminishing. It makes people feel like there's something irreparably wrong with them, like there's no reason for them to feel this way.
I understand where the sentiment comes from with these phrases and with this language, but it's not helpful to someone who is struggling deeply with this phobia. Affirmations help get me through, just like with birth, it helps get me through a nauseous episode. So some things that help me, and if someone were to say it to me, are, you can do hard things. I wrote this as a birth affirmation for myself when I had my home birth, but I also looked at it after birth when I would get nervous about being sick. You can do hard things, and that hard thing being throwing up. Affirmations kind of positively reinforce what's happening in the situation that might be negative, and that's helpful to me. But something that might also be helpful would be mindfulness. And I know that this is a super difficult thing for most people, and it's even difficult for me sometimes. But noticing the moments where you're kind of over worrying about being sick, or you're thinking too much about the future and getting sick in the future, rather than worrying, you can turn those thoughts around and say, right now, in this moment, I am safe and I am healthy.
Usually one of the first things I'll recommend are learning various relaxation techniques. Aggressive muscle relaxation is a big one. Mindfulness exercises are very helpful for grounding. These exercises work on the principle that a lot of the time the stomach discomfort is, if not caused by, certainly being exacerbated by the anxiety. And if you can get rid of the anxiety, you remove whatever portion of the stomach discomfort anxiety complex is being directly caused. I am working on a technique called mindfulness of digestion, which is based around learning to reinterpret or better interpret various unpleasant stomach sensations so as to not lump everything together as nausea. In addition to this, I use tried and true CBT and exposure and response prevention techniques. Exposure for emetophobia will stop short of actually requiring an emet to make themselves sick, because that's not something that can be approached gradually. An emet can approach external triggers gradually, watching cartoons of somebody being sick, and then watching unrealistic movies, and then more realistic movies, and then so on and so forth. Being sick is kind of an all or nothing proposition. You either are or you aren't. Sufferers are often ashamed of this phobia. The reactions of family members and even mental health care practitioners can contribute to that. They may try to minimize it, which makes the sufferer feel crazy and guilty for not being able to control their fear. Sufferers need to understand that their pain, their struggles, have validity. They are trying to conquer a really tricky anxiety disorder.
They dismiss or mock the phobia entirely, and that's not cool and that's not helpful. Like when I was gonna give birth, I mentioned to my OB, I have a fear of vomiting. Am I gonna get sick? And he told me most people get sick. That wasn't helpful. Had he listened and said, okay, this person has a fear, let's talk about why she might get sick. Let's talk about what the nurses can do to help her through this difficult time. I think being more conscious about people's traumas and phobias and what they deal with would be really helpful. Usually if I bring up my phobia to a provider, I want to know what my options are. I think that birth workers could be helpful, so hi birth workers if you're watching. There isn't much that doulas can do in their scope of practice with this phobia, but maybe some can. Maybe some have done trainings with trauma, maybe not specialized with the emetophobia, but maybe they know how to talk to a person who is dealing with this. Doulas, birth workers, you can help find clients that are dealing with this help. I've learned over the years that this phobia is more prominent in women than it is men.
So I'm in the minority of emets in that I'm male, and emets are disproportionately female. I don't know exactly why this is. There haven't been any studies on it, but it does make sense. In terms of percentages, I guess between 70 to 90% of emets are women. Of course, there may be more men suffering from it and suffering in silence, since men are less likely than women to speak out or seek help for a mental health disorder. But also nausea caused by hormonal fluctuations during the menstrual cycle. The female digestive tract is generally slower than the male digestive tract. The stomach empties at a slower rate, which can increase the risk of nausea and bloating. The large intestine tends to move more slowly, which increases the risk of constipation. Hormones such as progesterone, which is administered as a medication in the form of a combined oral contraceptive, and which is naturally released in large amounts during pregnancy, how a heightened tendency to have digestive disorders can combine with a heightened tendency to have anxiety disorders to create a greater risk of emetophobia, in addition to the unique nauseating stimuli that women may be subject to that men aren't.
And if you have emetophobia, feel free to share and talk about it. Just know that you've gotten through other months in the past like this, and you can do it again. Thank you for watching. Subscribe if you'd like.